Hello everyone, now let us discuss about 2023 E&M coding changes in hospital inpatient and observation care services. Now coming to the hospital observation services. The changes in 2023 mainly are all the hospital observation services have been deleted. The CPT 99217 has been deleted. To report the observation care discharge services, you need to see 99238 and 99239. These are inpatient discharge services. And similarly, CPTs 99218, 219, 220 have been deleted. They are the initial observation care services, new or established patient. Whenever we are coding the initial to report initial observation care, new or established patient, you need to see initial inpatient services. 99221, 99, 222, 99, 223. And similarly, 99, 224, 225, 226 have also been deleted. These are the subsequent care observation services. In order to report the subsequent care, you need to see the inpatient subsequent care. That is 99231, 232 and 233. So what are the CPTs that are deleted? 99217 is deleted. 99218, 219, 220 is deleted. And 99224, 225, 226. Total 7 CPTs are deleted. Now coming to hospital inpatient and observation care services. The following codes are used to report the initial and subsequent evaluation and management services provided to hospital inpatients and to patients designated as hospital outpatient status. Next point is hospital inpatient or observation care codes are also used to report partial hospitalization services. Partial hospitalization services are reported by hospital inpatient or observation care codes. And for patients designated or admitted as observation status in a hospital, it is not necessary that the patient be located in an observation area designated by the hospital. And if such area does exist in the hospital, that is a separate unit in the hospital in the emergency department, these codes may be utilized if the patient is placed in such area. In simple words, the patients designated or admitted as observation status need not be in a separate unit. Usually, if ever such area exists in the hospital, they can be placed in such area. That is the observation unit. And for patients admitted and discharged from the hospital, inpatient or observation status on the same day. For the admission and discharge on the same day, you need to report 99234, 235 and 236 as appropriate. And the total time on the date of encounter. The total time on the date of encounter is by calendar date. Using MDM or total time for code selection, a continuous service that spans the transition of two calendar dates is a single service and is reported on one calendar day. The continuous service which spans the transition of two calendar days is a single service and is reported on one calendar day. And if the service is continuous before and throughout the midnight, all the time may be applied to report the date of services. These two are important points. When a continuous service that spans the transition of two calendar days, that is, suppose the patient is admitted on 11 p.m. night 11 p.m. and then there is a transition of two calendar days. That is, though the patient has been admitted only for 1 hour, he will be passed to the next calendar day. So whenever a continuous service that spans the transition of two calendar dates, it is considered as a single service and is reported on one calendar day. And if the service is continuous before and throughout the midnight, before the midnight and throughout the midnight, all the time that may be applied to be reported date of the services. Suppose if the patient is admitted from 9 and the treatment is continued throughout the midnight, so both days are considered. Whenever a continuous service that spans the transition of 2 calendar dates, then it is considered as single service and is reported as 1 calendar day. If the service is continuous before and throughout the midnight, all the time may be applied to the reported date of services. It can be the before date and after date, if it is continuous before and throughout the midnight. Coming to hospital inpatient or observation care codes. New or established. Whether the patient is new or established, the following codes are used to report the first hospital inpatient or observation status encounter with the patient. There are no separate codes for new and established patient. Whether the patient is new or established, there are only one set of codes for initial hospital inpatient or observation care codes. And an initial service may be reported when the patient has not received any professional services. An initial service may be reported when the patient has not received any professional services from the physician or other qualified healthcare professional, or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice during the stay. Initial service is considered whenever the patient has not received any professional services from the physician or another physician of the exact specialty or subspecialty who belongs to the same group. When advanced practice nurses and physician assistants are working with the physicians, they are considered as working in the exact specialty and subspecialty as the physician. And for admission services for neonates requiring intensive observation, frequent intervention and other intensive care services, you need to see the 99477 that we have covered. For the admission services of neonates requiring intensive observation, frequent interventions and other intensive care services, you need to report 99477. Now let us see the scenarios and what is the coding guideline. First is when the patient is admitted to the hospital as an inpatient or to observation status in the course of an encounter in another site of service. For example, patient comes with chest pain to ER, emergency department or ED, and then he later gets admitted into the hospital. So when the patient is admitted to hospital as an inpatient or to observational status in the course of an encounter in another site of service. Here the patient is getting admitted from ER to inpatient. In such case, modifier 25 may be added to the other evaluation and management service to indicate a significant separately identifiable service by the same physician or other qualified healthcare professional was performed on the same day. Here, the ER E&M should be appended with 25 modifier. Initial may be coded, but along with ER code, you will append 25 modifier. That is one scenario. Next case, in the case when the service is in a separate site, a service is in a separate site and is reported, the initial inpatient or observation care services is a consultation service. In case when the service in a separate site are reported, so separate site services are reported. It can be outpatient, ER or nursing facility, any other. And the initial inpatient or observation care service is a consultation service. Whenever it is done as a consultation service, then you should not report either initial inpatient codes or the inpatient consultation codes 99221, 99222, 99223 and 99252, 253, 254 and 254. You should not report these two codes, though it is a consultation service, because initially the service has been performed in a separate site and the initial inpatient or observation care service is a consultation service. In such case, the consultant reports the subsequent hospital inpatient or observation care codes. Here the consultant should report subsequent hospital inpatient or observation care codes that are 99231, 232, 233 for the second service on the same day. This occurs on the same date of service. This also occurs on the same date. On the same day, first patient is coming to ER and then he is getting into hospital, getting admitted into the hospital. In this case, you are coding initial as well as the ER codes. In the second case, separate services have been performed in the separate site and the initial inpatient or observation care is only a consultation service. In such case, you need to report the subsequent inpatient or observation care codes for the second service on the same day. Third case is if a consultation is performed in anticipation of or related to an admission by another physician or other qualified healthcare professional. Then the same consultant performs an encounter once the patient is admitted by another physician or other qualified healthcare professional. In such case, also you need to report the consultant's inpatient encounter with appropriate subsequent care codes that are 99231, 232, 233. This applies when the consultation occurs on the date of admission or the date previous to the admission. This is applicable when the consultation occurs on the date of admission or a date previous to the admission. In both the cases, physician is same. In the third case, one physician is performing the consultation due to a patient who is admitted, whose admitting physician is different. In that case, the consultant will report subsequent care codes only. And for the patient admitted and discharged from the hospital in the patient or observation status on the same day, you need to report 99234, 235 and 236 as appropriate. And for the purpose of reporting an initial hospital inpatient or observation care service, a transition from observation level to inpatient does not constitute a new stay. The patient has been transferred from observation level to an inpatient level, then you should not consider it as a new admission or new stay for the purpose of reporting an initial hospital inpatient or observation care service. Now, the various codes for hospital inpatient or observation care codes are initial, subsequent and discharge. Fourth category, admission and discharge on same day. The initial inpatient or observation care codes come under the category 992212, 99223. And the subsequent hospital inpatient or observation care codes come under the category 992312, 99233. And the discharge hospital inpatient or observation care codes come under the category 99238 and 99239. And finally, whenever the patient gets admitted and discharged on the same day, then the reportable CPTs are come under the category 992342, 99236. First, coming to initial hospital inpatient or observation care codes. As we have discussed, there are three codes: 99221, 99222, 99233. 99221 requires straightforward or low MDM, whereas 99222 requires moderate MDM, and 99223 requires high complexity MDM. One more important point is all the hospital inpatient or observation care codes are revised, and I am not indicating here with a triangle. Please make note of that. All the codes are revised in 2023. First, coming to the description of 99221, initial hospital inpatient or observation care per day for the evaluation and management of a patient which requires a medically appropriate history and or examination and a straightforward or low level medical decision making. And whenever time is considered for code selection, 40 minutes must be met or exceeded in order to report 99221. This is the initial hospital inpatient or observation care codes. And in order to report 99322 initial inpatient services, MDM must be moderate, and the time, whenever time is considered, 55 minutes must be met or exceeded. In order to report 99222, MDM must be moderate. Moderate MDM is required, and 55 minutes must be met or exceeded. Either case. And in order to report 99223, MDM must be high, and the time must be 75 minutes must be met or exceeded in order to report 99223. Now coming to subsequent hospital inpatient or observation care codes. There are three subsequent hospital inpatient or observation care codes. They are 99231. Initial was 221. Subsequent is 231. 99231, 232, 233. 231 requires straightforward or low MDM. 232 requires moderate MDM. And 233 requires high MDM. Coming to the individual code description, 99231. This code is also revised. All the codes are revised. Subsequent hospital inpatient or observation care per day for the evaluation and management of a patient which requires a medically appropriate history and or examination and a straightforward or low level MDM. Straightforward or low level MDM. And whenever time is used for code selection, 25 minutes must be met or exceeded. And in order to report 232, MDM must be moderate and 35 minutes time must be met or exceeded. And in order to report 233, 99233, MDM must be high level of MDM, and whenever time is considered for code selection, 50 minutes must be met or exceeded. Now let us see an example. Dr. Jones documents Mrs. Smith's condition has improved during his third visit to her hospital room. Here the patient is already admitted in the hospital and it is her third day and the physician visits her for the third time. And upon entering the room, he finds her sitting in the bed watching television and eating breakfast. Dr. Jones performs a problem-focused exam and a low medical decision making. What CPT should be reported here? First thing is patient is already admitted. So it is not her initial visit. So you have to quote subsequent hospital inpatient or observation care code. Second is what is the MDM level? MDM level is low. So the appropriate CPT is 99231. Subsequent hospital inpatient or observation care per day for the evaluation and management of a patient which requires a medically appropriate history and or examination and a straightforward or low level of MDM. Here low level of MDM is performed. That is why we are coding 99231. Now coming to hospital inpatient or observation care services, including admission and discharge services on the same day. Now we will discuss the codes which include whenever the admission and discharge is performed on the same day. Now let us discuss hospital inpatient or observation care services including admission and discharge services on same day. The following codes are reported whenever the patient is admitted and discharged on the same date of service. And for the patient admitted to hospital inpatient or observation care or discharged on different date, then you need to see the regular, initial, subsequent and discharge codes. These codes 99234, 235 and 236 are coded only when discharge, admission and discharge is performed on same date of service. And these codes require two or more encounters on the same date, of which one of these encounters is an initial admission encounter and another encounter being a discharge encounter. Now coming to the codes. For admission and discharge services on same day, the codes are 99234, 235 and 236. 234 requires straightforward or low MDM, 235 requires moderate MDM and 236 requires high MDM. In order to report 99234, this is hospital inpatient or observation care per day for the evaluation and management of the patient including admission and discharge on the same day, which requires medically appropriate history and examination and a straightforward or low level of MDM. Whenever time is considered, 45 minutes must be met or exceeded. Coming to 99235. This requires moderate level of MDM and the time must be 70 minutes must be met or exceeded. Next, 236. It requires high level of MDM and that whenever time is considered for code selection, 85 minutes must be met or exceeded. Let us see an example. 80-year-old female was admitted this morning for observation status for the chest pain to rule out angina. A cardiologist performs a comprehensive history and comprehensive exam. Her chest pain has been relieved with the nitroglycerin drip given before admission and she would like to go home. The doctor has written prescription to add her to regimen. He has given her isosorbide and she was tolerating it well. He will go ahead and send her home. We will follow up with her in a week. Patient was admitted and discharged on the same date. Here, what is the MDM level? Patient is 80 years old and she is having chest pain to rule out angina. Chest pain has been relieved by nitroglycerin. So this is a new problem with systemic effects and prescription drug management has been done here. So you can go for moderate level of MDM. Moderate level of MDM and the patient is admitted and discharged on the same day. So the appropriate CPT is 99234. Sorry, 99235. Hospital inpatient or observation care per day for the evaluation and management of the patient, including admission and discharge on the same day, which requires a medically appropriate history and examination, and moderate level of MDM. Moderate level of MDM means 99235 for admission and discharge on same day. Now finally coming to hospital inpatient or observation discharge services. The hospital inpatient or observation discharge day management codes are to be used to report the total duration of time on the day of encounter spent. They are time-based codes and they report the total duration of time on the day of encounter spent by physician or other qualified healthcare professional for final hospital or observation discharge of a patient, even if the time spent by the physician or other qualified healthcare professional is not continuous. On that day is not continuous. And the codes include, as appropriate, final examination of the patient, discussion of the hospital stay, instructions for continuing care for all relevant caregivers, and preparation of discharge records, prescriptions, and referral forms. These codes are to be utilized to report all services provided to a patient on the date of discharge, if other than initial date of inpatient or observation status. These codes are utilized to report all services provided to the patient on the date of discharge. And for patients admitted and discharged on the same day, we have seen the earlier codes. You need to report 99234, 235 and 236 as appropriate. And the codes 99238 and 239, these are the discharge codes, are to be used by the physician or other qualified healthcare professional who is responsible for discharge services. They are used by the physicians who is responsible for the discharge services. Services by other physician or other qualified healthcare professionals that may include instructions to the patient and or family or caregiver, and coordination of post-discharge services may be reported with subsequent hospital care. Services by other physicians are reported with subsequent inpatient or observation care codes. Coming to the codes, hospital inpatient or observation discharge services, there are two codes 99238 and 239. If the total time spent by the physician on the date of discharge is 30 minutes or less, you need to report 99238. If it is more than 30 minutes, you need to report 99239. Coming to the CPT descriptions, 99238, hospital inpatient or observation discharge day management, 30 minutes or less on the date of encounter. And you need to report 99239 for hospital inpatient or observation discharge day management, more than 30 minutes on the date of encounter. Now let us see an example. A soccer player hits his head during an indoor game and is admitted to observation to watch for head trauma. The date of admission, admit date and time is 1/21/2023, 8:12 p.m. That is on the 21st January 2023 at 8:12 p.m. Patient is admitted. And during the admission, detailed history, detailed exam and low MDM is performed. Then discharge date and time is next day, 22nd Jan 2023. Time is 8:15 a.m. The discharge time spent is 20 minutes. The total time spent on the date of discharge is 20 minutes. What CPT codes are to be reported for admission and discharge to observation care? Here, the question is what is the CPT for the initial and what is the CPT for the discharge? Initial means the physician has performed detailed history, detailed exam and low MDM. So the code is 99221. Initial hospital inpatient or observation care per day for the E&M of patient which requires medically appropriate history and examination and a straightforward or low level of MDM. On the date of discharge, the total time spent is 20 minutes. So the appropriate code is 99238. Hospital inpatient or observation discharge day management 30 minutes or less on the date of encounter. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.